Was about 2 years ago, one Saturday morning. I was just going to the barber to get a haircut, and I actually got caught at the light at Greenmount and North and heard a group of ladies screaming that their friend had passed out, and they were saying, "Does anybody have that stuff? Does anybody have that drug? She passed out, she passed out." And I actually got caught at the light and looked over, and my first thought was, oh no, I have to actually do this, because that was my first time doing it. And all I had was my trainers in the trunk of my car, which were expired. And I had the auto injector and the nasal version. And I got out the car, quickly looked, said I work for the health department, I have Narcan. The ladies let me come over, and I just hit her with the auto injector. And it was an older woman, maybe late 40s, early 50s. She started to come out a little bit. I had two, again, expired versions of the nasal naloxone, gave her those two versions, and she actually came around by the time the paramedics got on the scene. I talked with her a little bit, talked with her friends to try to encourage them to get her to seek medical help, and they actually did. By the time I left and talked to the paramedic, she seemed like she was okay, so hopefully she recovered.
In the event that someone overdoses, every second is a matter between life and potential death. Within this video, we will show you the step-by-step process to administer naloxone and how to notice the signs of a potential overdose, and the experience people have had. Opioids are depressants, which decreases breathing and heart rate, which makes the most dangerous part of an overdose the lack of oxygen due to a decreased central nervous system.
So usually the signs and symptoms of an overdose is you're going to see a person maybe kind of nodding out. They might be unconscious. They're going to have slow snoring respirations. Their pupils are going to be really small. And sometimes in the late stages of an overdose, you'll notice that they're going to start turning blue.
The way that it has been measured in the hospital is in micrograms, but in the drug supply it's been measured in milligrams. So it is 10,000 times more potent than morphine. So when it reaches a drug like heroin and it's mixed in there, it's just very, very, very strong. That is really hard to say. It just depends on that person's tolerance. It depends on how much they used. It depends on how much fentanyl is really in, because that's what we've been seeing, really how potent that drug supply is. So that's kind of hard to say. It could happen in seconds, or it could happen, over a period of maybe 10 minutes.
The people who come to us for services, especially our clients, are a lot more than data and statistics. That these are people who actually have families, have friends, have people that care about them, inclusive of myself and our staff. That they are, despite what you may see on television or hear about in the news, these are really good people, and they've just had a lot of difficulties in their lives. They haven't had ways or skills or tools to be able to navigate through depression, through anxiety, through trauma, through a lot of things that they may have experienced in their lives, which led them actually to addiction.
Effects of opioids are pain relief, euphoria, itchiness, dryness of the mouth, sedation, respiratory depression, constipation, relaxation, and blue and gray fingertips and lips.
So fentanyl is, like I said, a fully synthetic opioid. It is completely made in a lab. It is given in a safe setting, in a hospital setting, and it's really been dangerous to people have been using it because the way that it has been measured in the hospital is in micrograms, but in the drug supply it's been measured in milligrams. So it is 10,000 times more potent than morphine. So when it reaches a drug like heroin and it's mixed in there, it's just very, very, very strong. No, I would say that no drug out there is safe from being contaminated with fentanyl. We have seen deaths that include cocaine and fentanyl. Obviously, we can't say whether they were used separately, but certainly the DEA has come out to say that the drug supply has been contaminated, the cocaine has been contaminated with fentanyl.
Today, I'll be demonstrating some different forms of naloxone that our program has distributed throughout the course of the time that we've been doing naloxone distribution. The first one that I'll be doing is the injectable version, which we used to give out in the fit packs, which were a little tricky to open, but inside the fit pack, you would get the nasal version. This is the intranasal version of naloxone, where you had the atomizer, you had the syringe that you actually administered the naloxone in, and you actually had the tube of naloxone. And how you actually administered this is you would take the yellow cap off and the yellow cap off the bottom of the syringe. You would take the purple top off of the dose of naloxone. You would screw it in like this. You'd attach the atomizer, and it's ready to use. So you would tilt the person's head back, and you would take the atomizer and the syringe, and you would inject it into the person's nose, one side. At one time it was only about 2 milligrams, so you would have to affix the second dose of naloxone to administer. If the person didn't come around within that 1 to 2 minute time period, you would administer it the same way. You would pop off all the colorful tabs, the purple cap on top of the naloxone, affix the atomizer, tilt the head back, and you would inject it the same way.
A lot of patients will call in and say they're sick, or that they're having trouble breathing, or that their friend or neighbor is sick or having trouble breathing. Through analysis of our runs and looking at what our providers put down as what we believe the type of call was, it's anywhere between 3,500 to 4,000 calls last year for overdoses.
So our program actually manages and operates the Baltimore City Syringe Exchange Program, as well as the Staying Alive Opiate Overdose Prevention Education and Naloxone Distribution Program. So we've been in service since 2000. We've been doing opiate overdose prevention education and distributing naloxone since 2004, and our syringe exchange program has been around since 1994.
So the Good Samaritan Law was put into place primarily to protect those who are using together or just a bystander that administers Narcan. It protects the person who's calling 911. So we never want somebody to leave a person because they're afraid that they might get in trouble because they were with somebody that was using. So the Good Samaritan Law protects the person from any type of legal action. If there's paraphernalia or anything like that, when first responders come, it protects them from getting in any type of trouble.
We have a partnership with the Baltimore City Health Department where we have a grant where we were given a lot of doses of Narcan that can be administered by civilians. And the way we do our Leave Behind program is that when we respond to an overdose, sometimes the patients don't want to be transported to the hospital. In fact, most of the time they don't want to be transported to the hospital, either through embarrassment or whatever other reason that they don't want to go. We also want to make sure that they don't overdose again. So we will leave them a kit, or we will leave a kit with the family members, because obviously the sooner you can administer naloxone to a patient, the more likely you are to be able to reverse their overdose and save them.
I would say if there was just one thing that I want them to know, it is that substance use disorder is a disease. It is not a moral failing. It is not a sign of weakness. It is a disease, and there is help out there for anybody that suffers with a substance use disorder.